Today is Wednesday, May the 28th, 2025, and in this video titled Mom, the Master Family Care Coordinator, I want to spend some time discussing patient education. I've done quite a few videos on patient advocacy, how to assess your medical treatment, how to advocate, how to do research around medical conditions and your providers. But in this particular video, I really want to focus on why patient education is important as a critical aspect of managing your own medical care. What I'd like to do is to share with you some notes and a few posts I have also done recently related to medical care and treatment in general. But here I am sharing with you more specifically a set of goals that Deja came home for us to begin to address in January of 2024. But we began talking about what goals we would have to work on together to help her to achieve the wellness goals that she had for herself. Deja also did a self-disclosure video designed to help others who may be experiencing the same kinds of health challenges that she has, which she hopes to grow as a cooking channel around food, healthy eating and healthy food preparation. So if you want to hear about her journey from her directly, then I would recommend that you take a look at her video. But here I'm sharing most of the goals that we set. Goal number 7 was a goal that I had her agree to because it was stated as a goal that I wanted, but it's something that I knew needed to happen because of the amount of trauma that Deja has experienced in order for her to be able to work through and to mature in managing her own medical care. I'm not going to read through all of these pages with you because I do this more thoroughly in the video, How to Conduct Your Own or Your Loved One's Medical Treatment Assessment. However, as both a mother and a professional helper or treatment provider around mental health, I wanted to show you how I outlined this for Deja and then how I began to assign tasks for her to work on or for us to work on together to begin to address the goals that she had for herself. Now, I'm not suggesting that parents would need to do this with their spouse or their kids. I'm sharing this with you because Deja was coming home to stay home in order to begin to work on this. I wanted to have a structure around how we were going to do this so that we would be able to accomplish the goals. I didn't know how long she was going to be willing to stay home. My hope was that she would stay home until we had achieved the goals, which she didn't. But I did want to make sure that we had something concrete that we could refer back to as an accountability measure. So you can take a look at how I started to work on these assignments with her, how I was thinking about what we were working on together, and what things I wanted her to begin to focus on and to begin to ask questions about herself so that when she met with her providers, she would be better educated and informed so that she could ask questions and be advised by them in ways that would be useful to her and to both of us as I have continued to try to support her in dealing with this ulcerative colitis. You can see here that where we left off was withdrawing assignment 1A because we realized that it was more important for her to achieve the goal to focus on assignment 2, which was around the anemia, as an example of how once you set a firm set of goals, they become flexible. You know, you have a framework, but then based on what happens as you go through the process, you may have to make adjustments. The objectives and tasks may change, the goals do not. This is a journal entry from February of 2022 that I wrote following Deja's first hospital stay for her ulcerative colitis and discharge. And as I reviewed the instructions and then as I talked with her about what she understood about it, these questions started to come to mind, because for me, the question overall is, what do you want patients to understand about their own medical care, and about their own diagnoses, which is a problem. Something that I address in the video on how city planning and mental health treatment planning are alike. It's like, do you want people to understand what's actually going on with them and how you're treating them? And is that the reason why you explain it with words that are difficult to understand and you have to look up and you have to do all this research to do? So my question was, what should the provider teach the patient? What does the patient need to know, and why would they need to know it? And this is, of course, in order to manage their own medical care, to be their own care coordinators. Is that what patients are taught? Why or why not? And does that make sense? Why or why not? What is the treatment goal? And I say, I'll answer that. The goal should be wellness or healing, complete healing. If the patient is not well, who is responsible? If the patient is not educated, can they be held responsible for the fact that they aren't healing well if they don't understand what's actually wrong with them and how the treatments are designed to work and what needs to be done when they're not working? Or is the physician responsible if they're not healing? How do medical providers receive their credentials? Who oversees and monitors provider performance? What measures are used to determine effective practice? What discipline or corrective methods are used or put in place to support effective treatment and provider supervision and support ongoing? Who supports the helpers? You know, the medical care field is overwhelmed right now. People have not recovered from the pandemic in the way that public health would want you to believe. And I know this because I tried to get Amaya an appointment as a new patient with the office where Jermaine and I have received treatment as have received primary care treatment. And they said there's a waiting list till August for them to even accept new patients. That doesn't count how long it would take to then have an appointment, which these days usually runs 3, 4, even 5 months out. Who advocates for provider quality of life and encourages their personal health and care? Who administrates the profession, regulates, protocols, support, so that they have a life and they aren't feeling overwhelmed in the work that they do and become so burned out that people can't receive quality care? Insurance companies cannot be the answer to any of these questions. There is no monetary value to my health and wellness. It's invaluable. It's priceless. Then I asked, who conducts clinical research? Where are the laboratories? How is research validated? How can I access the evidence of the clinical trials, such as videos, photos, etc., to know that it actually worked? Who determines which medications are controlled and which are publicly available? How are these decisions made? And are the process records available for public review if requested? Who oversees and monitors pharmacy inventory and distribution? And do drug manufacturers itemize their medicines and track the number of single doses dispensed to each pharmacy for distribution? Another question in consideration here is that when a person is discharged from a care facility, a nursing home, a hospital, how are the caregivers then educated? Now I'd like to take a look at a few posts and their cross posts, which are related to patient education for people who follow me and have been interested in how I involve myself in the medical care process, not only for myself, but for my children, and also those who want to help me to sort of expose for folks how the medical system works so that they can not only be better advocates for themselves and their family members, but also for medical treatment for the whole of our communities. In the next couple of posts, I'm referencing a television show called BOTCHED, which is about two doctors in California who are experts in corrective surgery, who focus their practice on helping people who have had significant damage caused by poor medical practice around plastic surgery. They also occasionally take cases of people who have physical deformities as a result of surgeries that were conducted for medical reasons. In this particular post, I write, I'm watching Botched again, the television show, season 5, episode 6, titled Nothing But Trouble. And I wanted to share something that occurred to me with this episode. In it, Dr. Dubrow is removing injected silicone from his patient, Tommy, which resulted not only in problems with her kidneys, but the disfigurement of her buttocks. I'm not bothered watching surgical procedures, so that what always intrigues me about the show are the ways Dr. Nassif and Dubrow explain what went wrong and the damage created by the procedures they then correct. As Dr. Dubrow is removing what he calls silicone granulomas, he explains that this is the body's attempt to form scar tissue around the silicone and wall it off. As I watched him do this, I thought to myself, the human body is amazing when given room to function as it is naturally designed to do. It's attempting to not only protect Tommy, but to correct the problem itself without any other intervention at all. How often are the residuals of natural healing processes diagnosed as something wrong, and then patients are encouraged to have those regenerative efforts of the body reduced or eliminated by medication or surgical procedures? Sometimes that makes sense, but I have found that isn't always necessary or wise. You have to do the research because there are people in medical science and research who do not want people to have access to or awareness of that kind of healing. While watching, I also thought to myself, this show might be the most concrete example I can share with people to observe regeneration and how the body works to heal itself from man-made or synthetic treatments, procedures, and toxic exposures. I've tried to explain to people in every possible way that one of the causes for cancer are foreign exposures embedded in the body that the body is trying to break down and get rid of. For example, if you're inhaling 2.5 PM particles daily for your entire life, the likelihood of developing respiratory and sinus-related complications later in life are greatly increased, even if you never smoke, even if you never have a surgical procedure. And I hope that makes sense to someone. If you have a high tolerance for mild nudity, blood, cutting, drilling, watch any of the accessible shows and begin to come to some conclusions on your own. I then want to go to this medical trauma, diseases, and surgical deformities in childhood post. I wish that I could simply put all the pieces together for people so that they make sense for them. But what I have learned is that the reality is that people have to be able to receive the information and have their own aha moment for it to begin to make sense. So I hope that you will do that and try to contemplate the full context of the message I'm sharing with you. In this post, I say, I've been binge watching the show Botched in the background as I've done other things today. It helps me to compare and contrast people who choose to undergo medical and surgical treatments of any kind. There are people who have been through hell medically who seek surgery that might allow them to feel normal. Then there are people who became victims as a result of their own vanity, who can also afford the expense to go under the knife again with seasoned professionals who have limited availability to perform these kinds of surgical corrections. The demand sets the price when your product is skills-based and you have years of satisfied patients or clients who can attest to a good experience and outcome. When Tristan's story was highlighted in season 4, episode 15 from 2018, it had my full attention. Doctors diagnosed him with Ewing sarcoma as a child and removed part of his tailbone and soft tissue, leaving him without glutes or rear end. Dr. Paul Nassif says during the episode, the patients that we usually see have bad results either because they've made bad decisions or have had bad doctors. He then sympathized with Tristan, who, unlike many of his patients, was botched at no fault of his own. In this case, it's different. This innocent child had a horrible disease that causes a severe, horrible problem that is exponentially more heartbreaking. Between alternating segments with another patient, I began researching Ewing's sarcoma because it's primarily found in children and young adults. When a disease is isolated by specific characteristics, I'm always curious about why it develops in one group of people over another. It grieves me that children are ever forced to endure a cancer diagnosis and treatments. It grieves me. I will never change my assertion that the causes for all disease and dysfunction can be known if complete healing, not just symptom relief, is the goal. It is also my assertion that all disease is curable if the cause is known, the correct remedies or treatments are given, and there is no recurring exposure to the cause. As I searched through the information available, it became clear to me that these sarcomas have an onset site pattern. Based upon the affected population, it made sense to me that there is a possibility the cause is injections. Bones in childhood are more permeable because they are still growing, like teeth. It is quite possible that the preparations used for injections could enter the bone and sit there, affecting the regenerative cells found in marrow. The legs, arms, and pelvis make sense to me. I'm still confused about why the ribs are also affected. I could continue to research correlations, but trying to justify my assumptions doesn't usually matter to people who read my posts in these cases. I realize that people still struggle with hearing me when I make these kinds of assumptions. An easier ask would be for anyone else who is interested, who also has influence and would like to impact outcomes, to work on documenting the site of injections through adulthood a legal requirement. In the attached screenshot from the Children's Hospital in Philadelphia, you can see that as of 2021, this kind of documentation is optional. If it were consistently documented across all pediatric domains nationally, and the data then shows children and young adults have a consistent pattern of developing sarcomas at these sites, a probable cause would be established. This is how I think. It must start somewhere. I appreciate the BOTCHED series and even Dr. Nassif's statement about bad doctors, because it makes my point that not all medical care is good. It isn't all bad either. However, there are bad doctors, bad hospitals, bad therapists, bad teachers, bad schools, bad politicians, etc., etc. There are also people in all of these roles who are very good. That there are good people providing these services should not compensate for those who are bad. What I have been asking people to consider over and over is how they know the difference. There are many scenarios presented on the show where people make clear their regret for not having asked themselves this question before they placed their trust in someone who ultimately created significant damage to both their physical and psychological health. That would have been prevention. Tristan ultimately decided that despite being given access to highly regarded corrective surgery specialists who also have a popular syndicated television show, that he would not have the procedure. He stated that he'd experienced too much trauma around repeated surgeries as a child, and as a result didn't want to voluntarily undergo a procedure that could not be completed in one operation. In this last post that I'd like to share, I'm discussing another way that I tend to make medical correlations, especially as it relates to my children. And that is to expose myself to whatever it is they are being exposed to, so I'm in a better position to help them should there be complications or if there are other issues that occur. In this post I write, I just completed some dental work having resin fillings placed in 2 of my wisdom teeth. It was recommended after my regular cleaning last month. I don't always follow these kinds of recommendations. It depends on why I went to see any physician in the first place and if whatever they tell me is something I am actually having problems with at that time. This is why I have refused to have my wisdom teeth removed, which is always recommended to anyone who visits a dentist regularly. There are no parts of the human anatomy that are not necessary and serve a specific function in the entire system of the body. People can live without all of these parts being fully functional or present in the body, but it's not what nature intended. Sometimes it's necessary to have tests or procedures done because we are all forced to live in a toxic environment. No one likes to be uncomfortable or in pain if that can be avoided. So damaged parts are repaired or removed. My teeth weren't bothering me, but they made the same recommendation for filling different teeth for my son LJ, who also had his teeth cleaned last month. Since my husband Jermaine decided to allow this, I agreed to undergo the filling procedure as well, because I always want to understand any side effects my kids are experiencing and ways I may be better able to help them. I'm not afraid of exposure or pain. I have a different understanding of what is meant by life essence. It's called regeneration, and there is an entire medical specialty to research and study it. Not everyone can access regenerative medicine because it's very expensive and not usually covered by insurance. The body will adapt. It always adapts, although living in an adaptive state isn't fully living. I decided to share this, as I usually do, my personal experiences, because the procedure requires numbing the area around the tooth to drill into it and then fill it. Since the affected lower and top wisdom teeth are on the same side of my mouth, the entire side of my face was numbed. It feels exactly how Bell's palsy looks, and I was told will take about 3 hours to wear off. My grandmother had Bell's palsy, which resolved on its own for some people. This didn't happen for her. Once she had the episode, it became a permanent change to her facial muscles and functioning. The medical community correlates Bell's palsy occasionally to stroke victims, but a person can have an episode of Bell's palsy in the absence of a stroke. The two do not consistently occur together. I wonder what the correlation is for people who have had dental procedures at any point prior, who then experienced Bell's palsy on the side where numbing occurred. There will be a differential for people who have had no dental work, or people who have had every part of their mouth numbed for various procedures. There are multiple alchemical, not a legitimate medical term, but one people know and understand unscientifically, combinations that could result in a medical problem in any part of the body, but you're looking for a consistent pattern here. Medical specialties should work in collaboration with each other, but they don't, and even if they did, the majority of us do not have providers who talk to each other in ways that they look closely at all of the various factors that may yield any specific medical ailment or outcome. We, however, can do this kind of research for ourselves and our loved ones. You're looking for causes because if the cause is known, the remedy can be found, and I hope that makes sense for someone. I then share again these particular videos, which will be linked in the description. I then add later, it's 4 hours following my procedure. Although most of the anesthetic has worn off, I still do not have full use of all the muscles around my mouth. F words make this the most obvious when I speak, and it made me think of Black natives in places like London and the UK who slur the F and F sound as a dialect. It doesn't mean all natives of the UK and surrounding areas have numb mouths, but could mean they learned to speak and understand language from people who did at some point in their lineages. It's another way to think about medical histories. I was going to record myself running through the vowel combinations fa, fi, fa, fo, fu, because visually it is very subtle, mostly undetectable, but you can hear it. I then started stretching the muscle to achieve the sound. This is why physical and speech therapy can be helpful in restoring function. I could make the sounds correctly, but the muscle is weakened right now. I thought sharing that might also help someone. So in conclusion, if at the core of treatment is helping the patient to be able to make better decisions in the absence of your ongoing presence, meaning that you're a provider who doesn't live with this person, is not living their life for them, but have an expectation that in order to work together, that they will make decisions and follow instructions which will help them to become well, then patient education has to include more than just the medications and any treatments that occur in an office or in a hospital. The only thing missing from this particular educational plan that I developed with DEJAH is looking at environmental factors and looking at the social support system. I didn't have to look at the social support system because I was going to be that along with her father and her siblings. But we also would have had to come to a place where we started to look at factors outside of her body and outside of her home to consider how they have impacted her overall health. These are all the things that are important to consider as a patient when you're seeking to be educated about what it is necessary for you to do and what is necessary to hold your provider accountable for so that you are able to heal and become well.